Imagine owning a business where customers come back every 6 months. The average transaction can be worth hundreds of dollars, and many services are paid for through insurance. That business is a dental practice. From the outside, dentistry looks simple. A dentist treats patients, patients pay, and the practice makes money. But underneath that model is a surprisingly complicated economic machine involving insurance reimbursements, labor costs, equipment financing, rent, supplies, patient retention, and the dentist's own time. So how profitable is owning a dental practice in America? And more importantly, where does the money actually go? Let's break down the economics. A dental practice essentially sells professional healthcare services. The revenue comes from procedures such as cleanings, fillings, crowns, root canals, implants, extractions, whitening, and other treatments. But unlike a typical retail business, the price displayed on the menu isn't always the amount the practice receives. Insurance companies can play a major role. Suppose a dentist performs a procedure that has a standard charge of $1,000. An insurance agreement might determine that the allowed amount is significantly lower. The insurer may pay part of that amount, while the patient covers the remainder through a copay or deductible. This means the dental practice has to manage two things simultaneously: how much it charges and how much it actually collects. And that distinction is critical. A practice can generate hundreds of thousands of dollars in billed procedures while collecting substantially less.
A dental office typically has several revenue categories. Preventive services are the foundation. Cleanings, examinations, x-rays, and routine checkups bring patients through the door regularly. These services may not generate enormous revenue individually, but they create something extremely valuable: recurring demand. A patient who comes in twice a year isn't just buying a cleaning. That appointment can uncover a cavity, damaged filling, gum disease, or another problem that requires additional treatment. This creates a natural economic funnel. Routine care brings patients into the practice. Diagnosis creates treatment opportunities. Treatment generates higher value revenue. And successful treatment can create another reason for the patient to return in the future. That recurring relationship is one of the biggest advantages of the dental business.
Not every dental procedure has the same economics. A basic cleaning requires professional labor, supplies, sterilization, equipment, and administrative time. More complex procedures can generate significantly more revenue per appointment. Crowns, bridges, implants, orthodontics, cosmetic procedures, and other specialized services can dramatically increase revenue per patient. But higher revenue doesn't automatically mean higher profit. A crown might generate thousands of dollars in revenue, but the practice still has laboratory expenses, materials, clinical labor, equipment costs, and administrative overhead. The real question isn't, how much did the dentist charge? It's, how much remains after delivering the service? That is the number that matters to the owner.
Here's where the economics become interesting. A dental practice is highly dependent on skilled labor. The dentist may be the most visible employee, but they're rarely the only person working. There can be dental hygienists, dental assistants, receptionists, office managers, billing specialists, and other staff. And unlike a vending machine or automated software business, you can't simply turn the practice on and walk away. Patients need people. Appointments need to be scheduled. Insurance claims need to be processed. Rooms need to be prepared and sterilized. Equipment needs to be maintained. Patients need follow-up communication. All of this creates a substantial labor bill. For an owner, controlling labor productivity is therefore one of the most important economic decisions. If a hygienist is sitting in an empty room for half the day, the practice is still paying that employee. The chair isn't producing revenue, but the wage continues. That's why appointment utilization matters so much.
Here's a useful way to think about a dental practice. The dental chair is essentially the factory. The dentist and staff are the workers. The appointment schedule is the production schedule, and each occupied chair hour represents potential revenue. If the chair is occupied by a paying patient, the practice is producing. If the chair sits empty, the practice is losing potential production without eliminating most of its fixed costs. That makes scheduling extremely important.
A cancellation at 10 a.m. doesn't simply mean an empty hour. It can represent hundreds of dollars in lost production. Multiply that across multiple chairs, multiple days, and an entire year, and poor scheduling can become one of the biggest hidden costs in the business. This is why successful practices focus heavily on reducing cancellations, filling openings, and keeping schedules efficient.
Then there's the physical location. A dental practice needs specialized space. You need treatment rooms, plumbing, electrical infrastructure, sterilization areas, waiting areas, imaging equipment, storage, and accessibility. That makes opening a dental practice much more expensive than opening a simple office. A new owner may face significant upfront costs for construction, equipment, computers, dental chairs, imaging systems, instruments, furniture, signage, and technology. And these investments create another important economic concept: depreciation. The equipment doesn't last forever. Dental chairs wear out. Imaging systems become outdated. Computers need replacement. Technology improves. So even when the practice isn't writing a check for new equipment every month, the owner still needs to think about the future cost of replacing those assets.
Many dental practices are financed with borrowed money. A dentist may need financing to acquire an existing practice, build a new office, purchase equipment, or renovate a location. Debt can accelerate growth, but it also creates fixed monthly payments. Imagine a practice generating strong revenue, but suddenly experiencing a decline in patient volume. The loan payment doesn't disappear. Neither does rent. Neither do many employee wages. This is the difference between revenue and cash flow. A business can look profitable on paper while still experiencing serious cash flow pressure. For an owner, managing that gap is essential. Dental economics are also heavily influenced by geography. A practice in a densely populated suburban market may have access to thousands of potential patients. A practice in a smaller community may face less competition, but also have a smaller potential customer base. Demographics matter too. Household income, age distribution, insurance coverage, population growth, and local competition can all influence demand. A dentist isn't simply buying a building, they're effectively buying access to a local market, and that market can determine whether a practice struggles to fill its chairs or has a waiting list.
One of the most important concepts in the business is patient lifetime value. Consider a patient who visits twice a year for 20 years. Even if each routine visit generates only a few $100s of collected revenue, that relationship can be worth thousands of dollars over time. And if that patient needs major treatment during those years, the economic value can be considerably higher. Now multiply that by hundreds or thousands of active patients. Suddenly, the patient database becomes one of the most valuable assets in the business. This is one reason established dental practices can be worth far more than the physical equipment inside the office. The buyer isn't just purchasing chairs and x-ray machines. They're purchasing an operating business with an existing patient base, reputation, staff, systems, and future revenue potential.
For a dentist, there's another major economic choice. Should you work as an employee or should you own the practice? Working for someone else can provide predictable compensation without requiring the dentist to manage payroll, rent, marketing, equipment financing, hiring, and administration. Ownership creates much more responsibility, but it also creates another source of income, the business itself. An owner can potentially earn money from their clinical work while also benefiting from the profitability and value of the practice. That's the central economic trade-off. More risk and responsibility in exchange for greater control and potential upside.
It isn't simply charging more. A strong dental practice usually has several things working together: high patient retention, efficient scheduling, strong collections, appropriate staffing, controlled supply costs, good utilization of treatment rooms, effective patient communication, and a steady flow of new patients. The most profitable practices don't necessarily have the highest prices. They often have the best operating system, because even a practice with enormous revenue can become mediocre if too much money leaks out through excessive labor costs, inefficient scheduling, high debt payments, expensive supplies, poor collections, or unnecessary overhead. So what makes owning a dental practice attractive? It's the combination of recurring demand,
high-value professional services, repeat customers, and the possibility of building an asset that can eventually be sold. But the business is far from passive. The owner is managing healthcare delivery, employees, insurance relationships, equipment, real estate costs, marketing, patient experience, and cash flow, all at the same time. The biggest misconception is that a dentist who generates $1 million in annual revenue personally takes home $1 million. They don't. Revenue has to pass through an entire economic machine before it becomes owner profit. Payroll takes a share, rent takes a share, supplies take a share, laboratories take a share, insurance adjustments reduce collections, debt takes a share, taxes take a share, and only what's left belongs to the owner. That's what makes the economics of dentistry so fascinating. The business isn't really about teeth. It's about converting limited chair time, skilled labor, equipment, and patient relationships into recurring economic value. And when those resources are managed exceptionally well, a seemingly ordinary dental office can become a remarkably valuable American small business. Thanks for watching.